Hi, everyone. My name is Selena Belisle, and I am one of the lymphatic drainage CE providers and instructors here at CE Institute. We teach lymphatic drainage both for the face and for the full body. We also do an extremities course for swollen extremities too. And today I'm going to tell you a little bit more about lymphatic facials. This has become one of the fastest growing trainings that we're doing at our school because a lot of clients are demanding and wanting these for their usually post cosmetic surgeries. We're going to review the Les Nouvelles Aesthetiques and Spa article that we wrote in February 2021 with all of you right now. So, the practice of lymphatic drainage, the reason why it probably still exists today is from oncology treatments. Lymphatic drainage has been really big for decades in treating cancer patients who have had oncology treatments where they either radiated or removed lymph nodes, and that created swelling. And lymphatic drainage was often practiced to relieve that swelling from the cancer treatment after lymph node damage. So while it's still being used for oncology today, the practice of cosmetic surgery, repair, and treatment is about 90% or more of our lymphatic facial trainings and practice. How does lymphatic drainage work? It's through simple little hand movements that we do over the skin. It's very specialized sequence that we work in, and we need to work towards different regional nodes within the face as well. So it's not like a Swedish massage or something where you're doing venous return towards the heart. And it's not like an aesthetics facial either, where you're constantly pulling up against gravity to improve the appearance of wrinkles. In lymphatic drainage, it does not follow either of these pathways. It goes in a different pathway of where you're working to relieve swelling from localized areas around the face. So with cosmetic procedures, think about all the cosmetic procedures that are being practiced in the market today. You have people who are having nose jobs, they're having mini facelifts, they're having full facelifts, they're having their eyelids done. And there's a lot of skin cancer with skin grafts going on as well, right? So all of these surgical procedures will cause swelling. And do you have physical therapy for facial surgery? Probably not. But we do know that secondary injury can occur when there's excess swelling in the body. That's because when there's swelling, it's actually pulling and stretching the tissue beyond its normal capacity. And when you do that, that tissue can tear, creating further injury and greater swelling. So it's really important when somebody's swollen to try and relieve that swelling as quickly as possible. You don't want to eliminate all of it, but you want to reduce some of it so you don't have secondary injury, which would prolong the healing process. We do want some swelling. That's what helps us heal. But unfortunately, the body usually doesn't know when to stop, and we have excess swelling. And that's why we have lymphatic drainage, because when we relieve some of that swelling, not only does it provide pain relief, but it can usually increase the recovery time and make it a lot faster of a recovery. Now, there are some people, there's a lot of reasons why we might want to practice lymphatic facials beyond post-surgical or oncology conditions as well. Are you aware that practicing a simple 25 to 30-minute lymphatic facial, you can actually improve lines and wrinkles on the place? It's on the face. It's a temporary improvement. Okay, you maybe have an hour before those lines and wrinkles come back. That's because as your heart continues to pump blood to the area, you'll have new circulation in the area. And as we age, we lose collagen and elastin in our skin, and it creates pockets where fluid gets trapped and we're swollen, and it can really make our wrinkles look more pronounced than what they really are. But within about an hour of your lymphatic facial, actually immediately when you finish, you should see, especially those who are 40, 50 years and older, who have deeper fissures in the skin, they usually will see a nice improvement in their lines and wrinkles. So we do have brides having lymphatic facials before their photography for their wedding photos. We have models practicing lymphatic drainage, and that is to also so they look, less. They need less Photoshop after all of these photos are taken. Maybe they've had a really rough night, and this is a way to get them back into looking a little bit better for their photo shoot. Also, think about we have met other surgeries that might not be cosmetic, but something like a tooth implant, dental implants, or wisdom tooth removal. These can create extreme swelling situations in the mouth, which can be extremely painful. And there's even published research. They did a study with third molar removal and lymphatic drainage, and they were able to relieve both swelling and pain with the practice of lymphatic drainage in that research study when they removed wisdom teeth. So even with, as long as infection's not present, even with dental surgeries, lymphatic facials can be provided. Another reason why somebody might want a lymphatic facial is because of the opioid crisis. There are some people that were opioid addicts, and they're very afraid after their wisdom tooth removal or dental implant surgery, or maybe they had facial cosmetic surgery. They don't want to take opioids again. Some people are adverse to opioids for various reasons, and over-the-counter NSAIDs might not provide enough relief for them. So lymphatic facials, it's a non-pharmacological option to be able to provide pain relief and increase your healing time so that you're suffering a little bit less than if you had gone without. So my name is Selena Belisle. We do teach the lymphatic facials here at CE Institute. You can find our classes at ceinstitute.com. There's the lymphatic drainage industry is just exploding right now. So if you're a massage therapist or body worker, we have cosmetologists, estheticians, nurses, PTs, OTs, all in our classes for lymphatic drainage. It's a very easy modality to learn. It's easy on your hands. You can sit down during lots of the treatment, and you're providing pain relief, usually to people who have no other means to gain that pain relief. So it's a really rewarding and experience and treatment, and it can be financially lucrative if you're in with the right clientele. So we hope to see you in one of our lymphatic drainage classes at the school. And until then, be safe.